Carr here from Anthony Middle School. She teaches 7th grade, and we're going to interview her a little bit about adolescent depression. 1 in 5 kids have depression. So what are some signs of adolescent depression, Ms. Carr?
Well, some that I've observed in my classroom are just an increase in irritability, loss of interest in something that they've previously loved to do, self-mutilation, hanging out with the wrong crowd, substance abuse, either drugs or alcohol, or just like aches and pains throughout their body.
Absolutely. So who does diagnose depression?
So if there's a suspicion of depression, the child will go to the doctor and get blood work done, and from there they'll rule out thyroid. If it comes back negative, then the psychologist will diagnose depression.
Absolutely. So what is the impact of adolescent depression in their cognitive functions?
Well, depression can interfere with a person's life, and especially in school, because depression makes it hard for a student to focus, makes it hard to concentrate on specific subjects. So it just interferes with the way that the school is run and the way that they study.
Okay, absolutely.
Although these symptoms can cause poor school performance, which might make one believe that the student is either lazy or they just don't care, the cognitive aspects of depression usually involve the person's thinking to be sluggish or negative or just distorted in reality.
Absolutely.
That's why it could easily be misdiagnosed, So depression can affect social development as well. They can be less social, which could have negative impacts on their development in their childhood.
So what impact of social-emotional functions do they have?
Well, they have emotional neglect, which is pretty common in cases of depression, and that, causes social disorders later on in life, and that can just cause a decrease in or even inability of just attachment styles.
You said something about their inability to attach to people, so what is their day-to-day functions and how do they deal with that?
Alright, yeah, excellent question. Depression can affect day-to-day life and can become more distressing, extreme anxiety and pain. Depression isn't just bad moods or feeling down or sad. Actually, some of these feelings are normal, which for some children, especially in teen years. But when these feelings last for a long time, it limits a person's ability to function normally. If a child is having a bad day, the smallest things like a bad test grade can cause depression.
Absolutely.
Sometimes these feelings can be managed or lessened with time. Depressed behavior may be mistaken for normal development problems. As children develop, their personalities change, making it more difficult to suspect depression.
So that is a lot of things for teachers to handle throughout the day. So what are some things that you do to help them?
One thing I try to do is identify the student and talk with him or her in just a caring and encouraging way. Those words can just go a long way. Then I encourage the student to seek help from the school counselor or medical professional. If you are not comfortable talking to the students, let the school counselor know about his or her issues. But if you are comfortable, just offer support. Let them know that you're there for them fully and unconditionally. Hold back from asking a lot of questions. Teenagers do not like to feel patronized or crowded.
Absolutely.
But make it clear that you're ready and willing to help them and get whatever support they need. So just be gentle but persistent at the same time. Don't give up if this adolescent shuts you down out first. Talking about depression can be very tough for them. Just be respectful and sensitive towards the teen's comfort levels, kind of gauge that, while still emphasizing your concern and willingness to listen. Just another thing that I think is really helpful is just to listen without lecturing. It's easy to criticize or pass judgment once a teenager begins to talk, but it's really important not to do. The important thing is just tell the child that this is an open sense of communication. Avoid offering unsolicited advice or making ultimatums. And I think another thing that is extremely important is just to validate their feelings. Don't try to talk the teen out of his or her depression, even if his or her feelings or concerns may appear just silly or irrational to you. Just simply acknowledging the pain and sadness that he or she is feeling. If you don't, he or she will feel like you don't take their emotions seriously. Overall, you just need to refer to the student to a school counselor. Let the school counselor know what is going on.
Absolutely. I believe the counselor is probably a good situation if the teacher's not able to handle adolescent.
Yeah, a lot of teachers don't know how to handle depression issues, so counselors are trained in that area, and that's what they specialize in, so it's always a good route to go.
Good to know. Thanks. Paxil is a common drug that adolescents take for depression, and a lot of people do take it. What is the controversial issue with Paxil or any sort of antidepressant drug?
As you had mentioned, Paxil and antidepressants have some negative connotations towards them, and they're just a major issue of just controversy. But antidepressant medications are often an effective way to treat teen depression and anxiety in children. However, antidepressants used in children and adolescents must be monitored like any other drug, as rarely there can be severe side effects. In fact, antidepressants carry a lot of Food and Drug Administration, so FDA, black box warnings regarding possible risk of increased suicidal behavior in some individuals under the age of 25. Although at first you may find that suicide warnings alarming, it's important to get the facts and treatment options. This will help you make an informed decision about your child's health and weigh the benefits and risks of treatment options with your child's doctor.
Thank you, Ms. Carr, for interviewing with us. It was great having you.
Thanks for having me. It's always a pleasure.
And that's the end of our interview tonight. Make sure you tune in next week for a mom whose child has just been diagnosed with autism.